lost their insurance coverage in the last year, is that right?
That's right. The U.S. Census released their report last year, and the numbers were shocking, I think, to everybody, Republicans, Democrats, and Independents, in that, 4 million, in gross numbers, 1.5 million Americans lost their insurance last year when you look at the total of people who have insurance. And that basically means there are about 50 million uninsured Americans in this country. And, whether you're pro-health care reform or against health care reform, that means a lot of people don't have health insurance right now.
And why does it matter if that many people don't have health insurance? Is it because they might get sick, or is it because it's going to cost us more if they go to the emergency room and they don't have any money and then we end up footing the bill?
It matters for so many reasons. We wouldn't be able to cover it in an entire day of talking, but I think that you can boil it down to a couple of key points. Number one, if you're one of the unlucky people who gets sick when you don't have health insurance, it's financially catastrophic for you. Again, health care has no political party, so when you're in trouble, it doesn't matter. Secondly, I think, to me, what's significant about this is think about how the whole health care reform law was structured. It was intended to provide more insurance to people who don't have it. So as the gross number of people without insurance goes up, fundamentally the cost of providing the insurance to these people goes up as well. So, one could argue that healthcare, and many do argue that healthcare reform will insure more people, but now the costs are going up. And the one thing, from my perspective, that the healthcare reform bill was lacking was really a solid footing to actually get costs under control, because a study came out last week that said healthcare is going to represent 20% of the gross domestic product by the year 2019. That's up from 16% today. That number is not sustainable.
So what do we need then? Because, as you know, I'm sure you were not living under a rock for the last 2 years. The health care legislation dominated the public conversation for
It did.
2 years. The entire last election was a big issue. And then it finally passed. Is that enough?
It's really not enough. And what's fascinating is it did dominate the conversation for 2 years, but it dominated the conversation in a way that, to me, was a little troubling. It was, and listen, I know, we all know how it works. To me, it was about the politics of healthcare reform. It wasn't necessarily about healthcare reform itself. So I think what we lost in the last 2 years was a meaningful conversation with the American public about the kinds of decisions people have to make about their health care and what this country is willing to pay for. I talk about this a lot on my radio show. How much do we want to spend on end-of-life care? How much do we want to spend on the next generation of drugs and technologies? Because every sequential step in discovery and life-prolonging treatment adds cost. And let's face it, we all want to live forever. Most of us want to live forever. But there's a price to that. And the American public hasn't really been able to participate in that conversation. They participated in the politics. I like the bill, I don't like the bill. It's 70% of the people surveyed a couple months ago still don't know what's in the law. So how do they really understand the difficult questions that need to be asked? To get this under control.
And so how do you do that? How do you make people understand?
Well, I think honestly, I think we're doing it now. I think you start the conversation with people, whether it be through the media, radio, or just, constitutional, Constitution Day readings and parties where people have the opportunity to talk about it, because the reality is government's going to have to tackle this, okay? Whether you believe in a small government or a large government. When healthcare reaches 20% of the economy, there's going to be no way out of this. So somebody's going to have to do something. And then you can only raise taxes to pay for this so much. You can only tax big businesses, small businesses, individuals so much to pay for something that represents 20% of your economy. So somebody's going to have to say, we're not paying for this anymore. And I think that, to me, the earlier you start the process, asking the difficult questions, looking at outcomes of diseases and saying, you know what? It's great that your life is extended 2 months for this drug, but we're not going to spend $100,000 to do it because we just can't afford it. I think the sooner you start having that and by the way, there's no right answer to that, but I think the sooner you start having that conversation, the more prepared we're going to be when we get to 2019, because it's going to happen. I'm telling you right now, it's going to happen.
And my last question for you mentioned the Constitution. Do you think health care is a right?
Listen, that's another question where there's no answer to it. Do I have an opinion? I think it's hard for anyone to ignore the plight of their neighbors. So, when we talk about what our forefathers had in mind in the Constitution, and the size of government and government's role in healthcare, they didn't have MRI scanners and CT scanners and these incredible drugs that we have today to keep us alive much longer. So I don't think you can really answer the question, is it a right or not? I think society in general wants to take care of each other. I think we live in a country where people fundamentally care about each other. And I think because there are now 50 million Americans who don't have access to health care insurance, and many of them will get sick, and many of them will have financial problems like you and I can't even imagine, I think we have to solve the problem. Whether you call that a right or not, to me that's just terminology. So I guess you'd say, yeah, I think it's a, if you want to force me into an answer, I'd say it's a right.
All right, Andrew Rubin, he has a healthcare radio show. It's called Healthcare Connect on Sirius Satellite and XM. What channel is that?
114, XM 119.
And what time?
It's Thursdays 10 to 12, and it replays throughout the week.
All right, great. Andrew Rubin, thank you very much. We will be right back after this.